as Miranda mentioned, this is going to count toward 1 CEU credit for those of you who are credentialed CHWs. Henaid will go ahead and drop a link. I think it's like a Google form for you all to fill out. And that is how we will collect your information to be able to send out a certificate of completion for the course. So it includes I think your name, email address, phone number, and how we can contact you. So that will be available toward the end of this presentation. We'll also follow up that way to do a brief evaluation of the course, including ways that we can improve it, and also just a quick learning check. The learning check is not designed to gonna get credit either way. So the learning check is more to make sure that we've sort of addressed all of the competencies and learning objectives that we hope to address today. All right. So any questions? I have you all so I can hopefully see if there are questions that come up throughout the presentation. But if someone needs to alert me, Miranda or Carla, maybe you can chime in and let me know if I'm missing someone. So
yep, we will have our eyes on the chat.
Thank you so much. It's a lot to manage with all these screens. So, all right. So welcome to today's presentation. My name is Caitlin Allen. I know a number of you from the past few years of work. I'm a consultant that has been working with Mark since about 2018 to help advance CHW training and support the workforce in Kansas City. So on both sides, Kansas and Missouri. So today I'm going to be discussing strategies for communicating with clients about the value of vaccinations and prevention measures in the era of COVID. So we will go ahead and get started here. I know that Carla and Miranda shared some housekeeping points here. So just to reiterate, this is a very informal and interactive training. We want for you to participate and be able to get in order to get the most out of this presentation. So please interrupt me, raise your hand, shoot a message to Carla or Miranda, and we will go ahead and get those questions answered as we're going through the presentation. If you're able to, again, put that webcam on if you're willing, and please also feel free to use the chat feature throughout. So this will last for about an hour. I'm cognizant of y'all's time, and I look forward to your participation. We are going to skip over the introduction since I've been on the call and heard you all and where you're from and the work you're doing. So unless you were not able to introduce yourself earlier, you can do that now in the chat, but otherwise I'll move on from here. So I have 6 learning objectives for the next hour. The goal by the end of this workshop is to define levels of public health prevention. So we'll take a little bit of time to do that. We'll talk about how vaccinations in general support disease prevention. We'll talk about health equity issues specifically related to the COVID-19 vaccination, explain how vaccinations work and how to communicate this information to clients. We'll address vaccine hesitancy while working with clients and talk through some strategies and case studies around this. And then I also want you all to have some resources to take away from today. So I'll provide those at the end of this presentation, and then Carla and Miranda can send around a document that we've created with links for additional resources to add to your toolkit. Does anyone have questions, comments, thoughts about our objectives for today?
I have a question.
Yes, Cheryl.
Yes, we've been working on, we had a couple of focus groups regarding vaccination hesitancy.
Okay.
And trying to get ideas, strategies of what we could do. So will you be sharing your presentation with us?
Yes, absolutely.
Okay.
More than happy to do that. And I
Okay.
think we'll probably be able to do that in the notes. Is that okay, Miranda? Yeah.
Okay, thank you.
Yep. I was gonna say, we'll send out all of the slides in the minutes. So that should be out within the next week or so.
Okay, great. Thank you.
Yeah, and Cheryl, would love to hear kind of any takeaways you've had from your focus groups and work that you've been doing, as well
Sure.
as others' experience. Great.
Thank you.
So we'll start with our first learning objective here. And this is to talk just broadly about levels of prevention in public health. This is something that you all might already be familiar with since you're working in the area of prevention on a day-to-day basis in your job as community health workers. And so prevention is really the act of stopping something bad from happening, right? At its very core sort of basic definition. And this is really especially important in the work we're doing when it comes to community or public health. And I want to start by defining 3 different areas of prevention that we think about when we think about sort of population health and public health work. These 3 approaches have different important roles to play in disease prevention. And the first is primary prevention. So this is interventions that prevent the onset of a future disease or problem, right? So very early on detection, very early on prevention before something has even started to happen. Secondary prevention is early interventions that might decrease the prevalence of a specific problem. So this is maybe identifying that there's a problem and doing something about it really early on. Tertiary prevention would be interventions that are improving the quality of life or reducing symptoms after a disease or an injury has occurred. So I would like, if you're able, to use the chat box to share which of these 3 levels of prevention you think might be a best option for reducing morbidity and mortality or death and disease. Primary prevention, secondary prevention sort of later, or tertiary prevention once the disease has occurred. So I will try to look at the chat here if you all want to see primary from Valencia. Great. Yeah, so you all are spot on. Primary prevention is the route we would love to go, right? Catching something before it even starts, right? So hopefully this is sort of good groundwork for all of us to be on the same page with some of the definitions around prevention. And this is just another kind of nice infographic for you all with regards to the different types of prevention strategies. As I mentioned, primary prevention are the strategies that are seeking to remove a risk factor or avoid the development, secondary being after it's occurred, and tertiary being to reduce those complications. While prevention screenings are often so I just wanted you all to have this, this available for future reference. We're going to hone in specifically on primary prevention here, since that's really where we are commonly working as community health workers. And so some examples of primary prevention that you all are probably quite familiar with is when you're providing education about healthy and safe habits like eating well, exercising regularly, quitting smoking. All of those are really primary prevention. We also see primary prevention in the areas of legislation, policy, right? So the idea of having health in all policy that's supporting primary prevention efforts, mandating safe and healthy practices at work, mandating seatbelts, bike helmets, all of those are primary prevention. Specific to COVID, we can see primary prevention in the requirements to wear masks in public places or workplaces. And even more specifically to the topic at hand today is immunizations against infectious diseases, right? So immunizations and all immunizations, and specifically the COVID-19 vaccine, is an example of a primary prevention effort. And so why immunize as a primary prevention strategy? So this is the practice of stopping something bad from happening, right? So we can use the COVID-19 vaccine and other vaccines as a really effective way to stop many diseases from happening in the first place. Specific to COVID-19, we know that the vaccinations help to reduce the risk of COVID and its very severe complications. All of the COVID-19 vaccines are currently authorized for use in the US, and they can help protect people from those severe illnesses. And we've seen this in clinical trials, as well as now that the vaccines have been out for quite a while, how safe and effective they are. And this is really why we're recommending, why immunizations are recommended both for COVID and also more broadly, because vaccines really work and because the COVID-19 vaccine works. So I want to move more deeply into vaccines and really how they support disease prevention. I'm going to start by reviewing a common set of terminology that should help familiarize you when discussing vaccinations. And I think this is really helpful when talking to clients. So sort of having this vocabulary in your back pocket and definitions so that you can share all of the information appropriately. So I have 4 terms here. The first is immunity. So immunity is a protection from an infectious disease. If you're immune to a disease, then you can be exposed to that disease without becoming infected again. Okay, so using the chat box, it would be great if you all can help me brainstorm some examples of an infectious disease that a person can become immune to. So this is something that once you've been exposed once, you will not be able to catch it again. Feel free to type chicken pox, smallpox, great, polio. So these are all the right answers. Excuse me, chickenpox was on my list. Tuberculosis is on the list. HIV/AIDS. Influenza or the cold is kind of tricky because there are so many different variations of the cold. Mononucleosis. So these are all kind of diseases that once you've been exposed, it's unlikely that you will be able to catch it again. The second definition is vaccine. So a vaccine is a product that stimulates a person's immune system to produce immunity to a specific disease, and that protects the person from that disease. Often vaccines are administered through a needle injection, but they can also be administered by mouth or sprayed into the nose. So again, using the chat box, can you all tell me some examples of vaccines that you've maybe heard of being administered through the mouth or that can be sprayed into the nose? Has anyone heard of a vaccine that can be sprayed into the nose or in your mouth?
I've heard of it, but I can't remember which specific one it was.
No worries. Flu, yeah, exactly. So you can actually, their vaccination, the flu vaccine you can get administered nasally. I don't know, for folks who have young children, rotavirus is something that they administer orally. And they also can administer typhoid vaccines nasally. So I think the most common one you'll hear is the flu, and rotavirus is another good example of oral vaccination. They just put a dropper under your tongue, under the child's tongue. The third definition is vaccination. And this is simply the act of introducing that vaccine into the body to produce immunity to a specific disease. And we'll be talking a lot more about immunity and the process of the vaccination on the next couple of slides. And then finally is immunization. Immunization is the process by which a person becomes protected against a disease through vaccination. So this term is often used interchangeably with inoculation or vaccination. So you've been immunized, you've been vaccinated, you've been inoculated. Those all are in that kind of bucket of meaning that the vaccine has been introduced into the body and there's been an immune response to the disease. So I have a little pop quiz. It's not really a pop quiz, but I'm curious to hear you all's thoughts about whether or not vaccines can be used for viral and bacterial infections. And so a viral infection is something like polio, flu, hepatitis, measles, and bacterial infections are things like typhoid, cholera, tetanus. So do you think that vaccines can be used for both types of infections, viral and bacterial? You can just type in yes or no, and we'll talk about it. True, yep, maybe, yes. Yes, true, yeah. Good, so yes, vaccinations can be used for both viral and bacterial infections. And this is an example, all of this kind of vaccination talk has been an example of acquired immunity. And that will bring us to our next topic here. So in order to make the connection between vaccines and disease prevention, I want to talk about the relationship between vaccines and herd immunity. So if you haven't heard of herd immunity before, this occurs when a large portion of a community or the herd becomes immune to a disease. So that makes the spread of a disease from person to person unlikely. So as a result, the whole community becomes protected, not just those who are immune, right? So if we can raise the level of immunity across the whole population, then we're protecting each other from that disease. There are two ways that we can achieve herd immunity. The first is through natural infection, this bullet here. And this is a passive approach. So this would be when enough people in the population have recovered from a disease and then therefore have developed antibodies against future infection, right? So if we were not to have any sort of vaccinations or things like that, we would see natural infection occur. And then eventually, maybe decades down the line, the population that is left would have achieved herd immunity. The other way to achieve herd immunity is through acquired immunity. And we do that through vaccinations. So this is when enough people have been vaccinated against the disease and therefore have protected antibodies against future infection. So if we can, you've sort of been hearing this in the news, right? So if we can get enough people in the US or in your city or state to get vaccinated, then we'll achieve a certain threshold and that will result in herd immunity. So that can be very motivating for people that by getting vaccinated, they're helping to protect other people and getting to herd immunity status. So herd immunity cannot necessarily, it is a really critical way to prevent the spread and damage of a disease in a community or in a population. All right. I'm going to go ahead and play a video on the next slide, and then we can pause and for any questions as you sort of absorb some of these concepts. If Carla and Miranda, you can holler if you have any trouble hearing this video or seeing it.
Oh, right now we cannot hear the sound. I don't know if you need to reshare
Okay.
For the audio portion.
All right. Share sound.
Person to the next.
Can you hear now?
Perfect. Yep,
So
that's
how
great.
can we stop the cycle of
All right, I'm going to go ahead and restart from the very beginning.
infectious diseases are caused by pathogens like viruses or bacteria that can jump from one person to the next. So how can we stop the cycle of transmission? Simple answer is immunity. Immunity is our body's ability to resist a pathogen via the immune system. Today we'll talk about herd immunity. Immunity zoomed out to the level of the population. To understand herd immunity, we first need to understand how we become immune to pathogens and how herd immunity works under ideal circumstances. Our bodies can gain immunity to pathogens in one of two ways: by getting and recovering from an infection, also known as natural immunity, or by receiving a vaccination. In both cases, our bodies generate a type of immunity called acquired immunity, which is like a protective shield for our bodies against outside invaders, similar to a moat around a castle. Acquired immunity can give us long-lasting immune protection through antibodies, proteins that help our immune systems recognize and destroy pathogens. For infectious diseases, this not only protects you from getting sick when you're exposed to the pathogen for a second time, but can also prevent you from spreading the disease to other people. This is a great way to prevent the spread of disease because the more people in a population who become immune, the less that pathogen is able to jump from person to person, essentially breaking the cycle of transmission. When enough people in a population become immune, the rest of the population is protected by proxy, establishing herd immunity. This is particularly important for people whose immune systems are too fragile to develop natural immunity or get a vaccination, like the elderly, the very young, or those who are immunocompromised.
All right, so I will pause there. This video is 6.5 minutes long. So when we send out the presentation, you're more than welcome to continue listening to it. And I think it's also a potentially good resource for you all as CHWs to share with clients who might be interested in learning more about these topics. Okay, so I want to pause here and see if there are any questions so far and give you all a moment to sort of absorb and let me know if I can answer anything before we move on to the rest of our learning objectives. You're welcome to unmute yourself or you can type into the chat. I see great video, great visual, yeah.
I think it's like not a question, but maybe more of a comment. I think that I find the most success when talking to people about the COVID vaccine when I, link it to kind of like what you did, like current either diseases or vaccinations or maybe things of the past that we've had. People seem to kind of get a better understanding that way.
Great, thanks for that comment, Miranda. Have others had similar experiences? It's awesome to reach out to people in the form of a flyer from Kinley. Great. And we will go ahead toward the end of this presentation and talk through a case study and an example for you all to be able to share some more strategies that might be effective in talking to folks about the vaccine. So I want to talk about health equity next, particularly as it relates to the vaccination. And the sort of definition that I'm going to be using for health equity is that health equity is achieved when every person has the opportunity to attain his or her full health potential, and that no one has disadvantage from achieving this potential because of their social position or other socially determined circumstances. And unfortunately, as I'm sure you all are very aware of, many communities face health inequities, which are reflected sort of in different lengths of life, quality of life, disease, disability, and death, as well as severity of disease and access to treatment. And I think we've seen this be especially true when it comes to COVID-19, and especially true when it comes to access, availability, knowledge, et cetera, around the COVID-19 vaccination. So there are many social, geographic, political, economic, and environmental factors that we know can create challenges to vaccine access and acceptability, or people's perceptions about the utility, the importance of vaccines. And this often affects groups that are already underserved. So in the chat, I would love to hear some examples from you all of health inequities that are affecting clients and communities that you're working with currently. So these don't have to be specific to COVID-19, they can be, but just any sort of health inequities that you're seeing in your day-to-day work. Housing. Having few specialists in their area. Healthy food. Transportation. Health insurance. Affordable quality medical care. Navigation. Great, these are great examples. Some other ideas that I might put out there are racism and other forms of discrimination, as well as lack of trust that might be a result from past medical racism or experimentation. And so because of these and other challenges, their minority populations it's been shown that minority populations are less likely to be vaccinated against the COVID-19 vaccine in comparison to majority groups. And in addition to being less likely to get the vaccine, minority populations are also more likely to get seriously ill and die from the COVID-19 vaccine due to those factors that you all have listed, right? So if you can't get access to services and things like that. So it's this really a double-edged sword. So I want to share with you some data that we have available regarding race and ethnicity from the CDC COVID-19 data tracker. This is a resource that you can review in your own time and sort of do a deeper dive, but I want to share high-level CDC data as of September 1st, 2021. So it's almost 2 months old now. This is when I first was developing the presentation. So you can see that at that time, there were about 110 million people fully vaccinated, with 2/3 being white, 9% being Black or African American, 17% Hispanic, 6% Asian, and 1% American Indian or Alaska Native. And then, as you can see, the number of those who are fully vaccinated in the racial and ethnic minority groups are much lower compared to white groups. And as we know, these groups have also been more severely affected by COVID-19 than non-Hispanic white people have. again, due to many of those reasons that we've discussed on the previous slide. At this time, the CDC is not publicly reporting state level data on racial and ethnic comparisons of people vaccinated. So so this is at the national level. I do provide a couple of resources in the next two slides that are around Missouri and also Kansas, okay? I won't have time right now to go into detail about these two slides, but I wanted you all to be able to take a look at the state and area that you all are working in. And there are sources to gathering more information about percent of vaccinations, number of cases, and number of deaths across racial groups. So now that you all are armed with this information about health equity and the COVID-19 vaccine, I would love to hear some ideas about what you might be able to do as CHWs in order to improve COVID-19 vaccine equity. So if you have thoughts, go ahead and share those in your chat, in the chat, or feel free to unmute yourself if there's things that you all have done or had experience with that have been successful in promoting vaccine equity. Sharing your own experience, meet them where they are and understand why they haven't gotten the vaccine. Listening to concerns before jumping into why they should. So it sounds like motivational interviewing. Providing information on their questions. That's exactly, Rickson, that was it. I was just going to say that. So sharing clear and accurate information from trusted sources in order to educate your community about COVID-19. You can help raise awareness about the benefits and address common questions and concerns that are coming up. You can also adapt various messages that maybe are available from the CDC or state health department. You can adapt those messages to the language or tone or format that might best resonate with communities, or you can find resources that are tailored to your community specifically. And I think in the resource section, I have some really good examples of a compilation of resources that are tailored to specific communities. So I want to give you all a bit of a strategy here to help continue to have those conversations about the vaccine. And so you can build your comfort in explaining how vaccines work to your clients. We know that you all want to be equipped with the best, most reliable information that you can have and present that to your clients so that they can make informed decisions regarding their health and overall well-being. So the strategy that I want to share with you is called the 5W framework. And this is a simple method that you can use to share information about the vaccine, the COVID-19 vaccine, any vaccine, or really kind of any health intervention that you want to share with your clients. This has been used in journalism to investigate a story, but the same approach can be used to ensure that you have all of the components needed for interacting with your clients and be prepared to answer questions or give information that addresses the 5 W's. So the 5 W's are who, what, when, why, and where. And another W that might come up specifically with regards to the COVID-19 vaccine is which. So which vaccine should I be taking? Or which now third dose, a booster dose, should I be taking? So does anyone have questions or thoughts or concerns about this, this framework? We have, what, being able to address the what is the vaccine, who is affected or most at risk, being able to answer questions about that. We know elderly and young. Why get the vaccine? When should I go to the doctor if I feel sick? So if you've had COVID, that would be a when, or when should I get the vaccine? Maybe when talking to pregnant individuals who are contemplating whether or not to get the vaccine. Where do I go? And some of those issues that we talked about with access to healthcare providers and access to getting the vaccine. And then again, which vaccine should I take, which we'll talk about here in just a minute on the next slide. So any thoughts about this framework before I move on?
Yes, I have a question. In regards to, let's see, why, when. So I know during our focus groups, one of the questions came up that if your provider is not for getting vaccinated, that carries a lot of weight, of course. And so I don't know if those numbers, I don't know where we would even find the data of who are the providers that's not for getting vaccinated type of thing, because I mean, I can imagine if my provider said something like that. I think just the other day, my provider was saying, are you going to take the shingles vaccine? And I was like, well, did you take it? And he was like, yes. So if he would have said no, I'm sure I would be not interested. So that was just something that was really interesting to me, that, because that carries a lot of weight. So just to consider that type of, if that's part of the framework, how do you address something like that?
Cheryl, thanks for sending that or sharing that experience. Do any others have a similar experience or maybe thoughts in response to how they might address a client that has had an experience like that with a provider?
Not necessarily always with the provider, but their pastor of their church. If they don't, and a lot of people are, the faith-based, and if my pastor doesn't believe in it, then I'm not going to do it because my pastor doesn't believe in it. So, I would just kind of piggyback off what she said in regards to the physician, but I think more so if your pastor or your community that surrounds you, your own little microcosm, isn't interested in the vaccine, then, sometimes you don't want to be the outsider. So I'm not going to give it either. So I think that, is a problem as well.
Thanks, Essence. That's a really good point as well. Any other thoughts to share? So we'll be looking, go ahead, Cordy.
I think in this situation, this is where we could highlight more of self-care, education in that area, because when we do have key people in our lives that can weigh or sway people's decisions, if we're teaching and working with our clients to help them or patients to be more independent and more involved in their self-care, in their medical care, in their holistic care, then as we're talking to them about being more involved in their health care, then helping them to accept the responsibility of their own decisions, even though somebody important in their lives have their opinions. Our patients or our clients should be more encouraged to step out on their own to make decisions about their health care. And I do understand that these are key bias or unconscious bias that may be affecting people's decisions to make healthier choices.
Yeah.
That's my 2 cents.
Thanks, Cordy, for sharing. I think that, so it sounds like some strategies that have been shared to addressing kind of these, we've been talking a lot about the individual level and convincing one individual at a time. And what you all are bringing up is more higher level, sort of maybe providers or clergy and kind of group think around vaccine hesitancy. So Cordy's point of kind of making it a personal sort of ask and taking care of yourself, that could be one strategy to helping to reduce hesitancy. Another strategy might be also if you have relationships with clergy in a church, for example, speaking to them one-on-one about kind of their barriers to or hesitancy to getting vaccinated, and maybe talk about and address those so that they can then sort of make hopefully a more informed decision and then be able to promote getting the vaccine and sort of change that conversation within those communities. So a couple of notes from the chat. We had a great point, someone said, and then also hesitancy. It's almost like people become a belief system. Yeah. And people use the word, I don't believe in it. Someone else mentioned, yes, right now we are still in this strange phase where it is not only a medical decision, but also a political one, which makes it more challenging. Great. So in the interest of time, I'm going to move forward a little bit with the which, so those 5 W's plus the 6th W here, which is which vaccine to get. This may be something that comes up with kind of which is better and things like that. So here is information, and I would encourage you to go back to the CDC website because this information is getting updated even as of a few days ago. But the COVID-19 manufacturers are listed here. So there are several companies. I have Pfizer, Moderna, and Johnson & Johnson on this slide. All of these have vaccines out that have been found to be safe, effective, and will reduce the risk of severe illness for COVID-19. And so there has been really kind of ongoing conversations and news stories about which vaccine is effective, which you should use for a booster, et cetera. And so it's important for you to sort of know the eligibility criteria of the different vaccines, how many injections are needed, the time it takes before someone is considered fully vaccinated, and sort of the common questions that are coming up around each of these different brands and manufacturers. I know it's a lot to keep up with, and I think it's fair to share that info, share as much as with clients, and also be clear that it can be hard to keep up with these things because we're sort of developing and sort of advancing science while also trying to improve community health. Cheryl, did you have a comment?
Yes, going back to the prior screen on the Johnson & Johnson, it stated, when are you fully vaccinated? And it states 2 weeks after the second shot.
That's incorrect.
Shot. Yep. So that probably needs to be.
That is incorrect. Thank you for pointing that out.
Yeah.
And then also this table is actually even out of date because we can now, I know that some of the manufacturers have just approved for 5 to 12. And so, like I said, this is a fast moving target for keeping up with the different availability. So there's also the importance of boosters, right? And we're in the era where we're having recommendations for boosters. And this information here is also probably a little bit out of date, since even a week or so ago when finishing the presentation for today. So I would say that, again, it's really important to keep up with the latest recommendations. And I would always point you to the CDC website for the most up-to-date information about the different boosters that are available and how who is eligible at that time, and other recommendations. So I want to take the last bit of our time today to talk through a case study about addressing vaccine hesitancy while working with clients. And I will go ahead and share a case study about Vivienne. And I'll leave this up here, but kind of talk you through this individual, Vivienne, and her hesitance around getting the vaccine. So you're welcome to share ideas as I talk through this. You can write them in the chat, and then we'll open up for conversation after. So Vivienne is 33 years old. She's a single mother of teen twin girls. And she has experienced many complications during her birthing experience. So she had a really lengthy postpartum recovery and hemorrhage during her birth experience. She, since giving birth, has felt that she's had a great deal of judgment and kind of sees herself as being considered a statistic from medical staff that she interacts with since she became a teen mother. She uses social media, which has been telling her about all of the disparities in medical care, especially for women of color. She has never had a medical provider of color. She has chronic diseases that run in her family, and she's hesitant about getting the vaccine for herself, as well as for her daughters. So her daughters, let's say her daughters are eligible, they're teens and they're eligible to get it. She and her daughters have received all other recommended CDC vaccines. So they got their shots when they were young. So I wanna hear from you all, kind of these questions at the bottom. How can you begin to address Vivienne's hesitancy? How might you be able to start unraveling some of Vivienne's past and its negative ties to her medical care and distrust? Are there any resources that you might share based on our conversations today that might help her to make an informed decision? Feel free to type in the chat or unmute yourself. Has anyone had a similar experience? Yeah, Miranda.
I do not have a similar experience, but I was going to say maybe something to start with, you know, is like being empathetic and like acknowledging all of those things that she has been through and that are a reality for her that maybe are not a reality for others because of her, you know, the judgment of being a statistic and that she was a teen mom and that she is a woman of color and those kind of things.
Thank you for sharing. I have a note in the chat. I would share some factual data on how COVID has been impacting people with high blood pressure and sugar issues. I'd ask her if she wanted to talk to a medical professional to see if someone from the Black Healthcare Coalition would talk to her. Maybe start out by telling the patient, I hear you, I value your concerns, and then share some more accurate information. Find out if there are any trusted members of Vivienne's community who have been vaccinated and encourage Vivienne to talk to them about why they chose to get vaccinated. You guys are on it, so smart, great strategies. It's hard to convey the message, but sharing our own experience might help. Again, it depends on where she's coming from, right? So if you have a similar life experience to Vivienne, being able to share that with her. So I think a really kind of a common theme I'm hearing too is connecting the kind of decision making that that you're trying to have her do with something that she's either already doing or has some sort of experience with, right? So for example, you know, making a very clear connection, Valencia mentioned, with some factual data about how COVID is more likely to negatively impact people who have high blood pressure and diabetes, right? So that could be really something, if she's concerned about that, you could talk to her about that since it directly affects her. And then the idea of connecting her to local resources like the Black Healthcare Coalition is great, so that, you know, she can be speaking with someone since she's never had an experience with a medical provider of color. Let's see, a couple of other comments have come in. So if there's someone else who's a teen mother in the community that is trusted, you know, there's the teen mom program that she could get connected with. One point that I might also mention is that she and her daughters have received all other recommended CDC vaccines. And someone mentioned this earlier, but, you know, relating that back to relating the COVID-19 vaccine back to those other vaccines, right? And explaining that, you know, just like you had your daughters get vaccinated when they were very little against common diseases, you know, the COVID-19 vaccine is similar, it's safe, effective, et cetera. So sort of linking it back to other vaccines that she trusts. Any final comments about this before we move on? Great ideas and examples. So I do have a second case study. We won't have time to talk about it today, but I would encourage you, when Miranda and Carla send around the slides, you can read through this and think about it. This case study is, excuse me, about a sort of community level challenges, right? And so I think this gets to some of the questions that were brought up earlier around, you know, what if a church pastor has issues with the vaccine? What if there are challenges sort of with providers and things like that? So this case study could help you think through and give you some examples of strategies to address those barriers at the higher levels. So I want to take the last few minutes of our time together to get through our final learning objective, which is to assemble educational resources to support decision-making about the COVID-19 vaccine. So I've shared with you a number of different resources throughout this presentation, and then I also have a handout that will include in the follow-up email for you all to build on. So I've included mostly national level and state level resources, but I would encourage you all to even put together resources from the chat and conversations with each other that are more local and accessible. So I would encourage, and we're going to actually have a CEU about sort of identifying credible sources in the winter, but in the meantime, I would encourage you to make sure that you are gathering credible sources, and also that your clients are looking at credible sources when getting information about about vaccines. There are a lot of resources out there that are, fake or misguided or misinformed. And so, places like the CDC, Mayo Clinic, and Johns Hopkins are really wonderful, wonderful spots to start. There's also local credible resources, state and local health departments, CBOs, and then culturally and linguistically appropriate information like educational campaigns and toolkits. So those include, I know NAVAJO also has toolkits of resources as well for CHWs. So here's a list of with some links that you can click on and start adding to your toolkit. I would say that a year ago, it was really, really difficult to find these types of educational and outreach materials to support your communities. And now I actually think it's there might be an overwhelming number. I want to hear a little bit more about where you all are going right now to gather information and educational resources for clients. Is there anything kind of top of mind that I've missed, or any place that you all love to go right now when talking about this? I'll take that as a sign of no, we've got everything, but CDC or health department, yeah, great. All right, in our last moments here, I just want to go back over the different learning objectives that we talked about in the very beginning. We started by defining levels of public health prevention and kind of linked the COVID vaccine and other vaccines to the primary level of prevention. We described how vaccinations support disease prevention. We talked about health equity issues related to the COVID-19 vaccine. We talked through different vocabulary that are important and how to communicate health information to clients. And then also talked about assembling educational materials in order to support client decision-making. So I know we have about 2 or 3 minutes left, and I want to turn the floor back over to Carla and Miranda if there's anything else you guys need to talk about. And Hanaid will drop a link into the chat, I believe, for you all to type in your information so that we can be sure to provide you with CEU credits if you need those today. Thank you so much for your time and participation.